Peace be upon you. I welcome your excellencies, members of Diplomacy Network, and we welcome His Excellency Dr.Abdullatif Mohammed Khal, Head of National Strategic Committee related to combating COVID-19 under the Ministry of Health. We will also welcome Qatar University professors and students, and we also welcome our esteemed guests. We welcome you to our second live seminar from the Diplomacy Network from the State of Qatar in collaboration with the Department of Humanities in Qatar University. Our guest today is one of the famous figures in the field of medicine in the state of Qatar, Dr. Abdullatif Mohammed Khal. I'll give you a brief introduction about this great man. He is Deputy Chief Medical Officer, Director and Designated Institutional Official, DIO, Medical Educational Department, Chairman of National Pandemic Preparedness Committee. He is also head of communicable diseases in Hamad Medical Corporation. HMIC. Dr. Abdullatif graduated in 1989 from Royal College of Surgeons in Ireland. He is a member of HMC Doctors and one of the people working in combating COVID-19 in Qatar. Doctor has occupied many positions and still giving. Among the most important positions he held were administrative positions, medical and educational positions. He is a member of Weill Cornell Medicine University since 2007 and a member in College of Medicine in Qatar University. Dr. Abdullatif Khal will tell us today the story of COVID-19 in Qatar. Doctor, the floor is yours.
Good morning, everyone, and thank you very much, Dr. Khalid, for your kind introduction. Today, I'll try to describe the response of the state of Qatar to contain the COVID-19 pandemic. I have no conflict of interest to disclose. I'm having slight difficulty in switching the slides. Slides are not moving.
Slides are not moving.
I apologize for this. Okay, so they are moving now. Sorry about that. As most of you know, this all started about 9 months ago in China, when the city of Wuhan, which is a very large industrial and business city in China, started noticing an increasing number of people presenting to their hospitals with a mysterious type of pneumonia that could not be attributed to any known viruses or bacteria. This probably was noticed for the first time in the first week of December of 2019. By December 31st, the official Wuhan, China, the officials in Wuhan city through the state of China or the Republic of China reported to the World Health Organization a cluster of cases of pneumonia that could not be attributed to any known organism. By the 7th of January, the Chinese discovered the virus that caused pneumonia, and they notified WHO around the 10th, and the virus structure was available on the website for the rest of the world to look at. The first case that was confirmed outside of China was on the 13th of January in Thailand. And by the 30th of January, the World Health Organization declared the new epidemic or the new virus as a public health emergency of international concern, and it was not until March 11th when the World Health Organization declared it as a pandemic. On 23rd of January, China imposed lockdown on Wuhan, preventing people from traveling in or out of the city, but that did not stop the spread of the virus to the rest of the world. It is thought that the virus had probably been circulating for a few weeks before it was first reported in the end of December, and that millions of people have traveled out of Wuhan to other parts of the world and to other cities in China before the virus was discovered. And that probably has led to the widespread of the virus to the rest of the world. The virus is actively spreading throughout the world. It's relentless. It's affecting all countries of the world. The daily numbers that are reported by countries has reached a high record of more than 300,000 daily cases that are reported to the World Health Organization, and it's believed that the true number is probably 10 times more than the reported cases. And the number of deaths that have been reported to the World Health Organization have exceeded 970,000. And the true number of deaths is not known, but it's more than that because of a number of reasons, including the difficulty in diagnosing all deaths that happen in countries or parts of the world where they don't have access to laboratory testing. This slide shows the current state of the epidemic in different parts of the world, and you can notice that in most parts of the world, the virus is actively spreading, and it's coming back as second wave in some geographic locations, like in Europe and in North America and South America, and also in Southeast Asia, particularly in India. So the virus is still actively spreading and is still causing more and more cases that lead to morbidity and mortality. And the numbers probably are going to accelerate in some parts of the world, including in some European countries. I would like to describe the virus and its family, the coronavirus, over the next two slides. So what are the coronaviruses? The coronaviruses are a group of RNA viruses that cause disease in mammals and birds. In humans and birds, they cause respiratory tract infections, which can range from mild to all the way to lethal infections. In cows and pigs, they cause usually diarrhea, and while in mice, they can cause hepatitis and encephalomyelitis. There are 4 human coronaviruses that are known to cause infections since the 1960s. 2 of them, the O43 and the 229E, have been responsible for up to 30% of the common cold throughout the world. There are the other 3 that were added recently, relatively recently, to the list of human coronaviruses include SARS-CoV, which started in 2003, and MERS-CoV, which started in 2012, and now recently the SARS-CoV-2, which started in December 2019. SARS and MERS were contained, fortunately, because of human interventions, mainly public health interventions, and because of viral characteristics that are not yet known completely. And there is a chance that scientists failed to identify a major coronavirus pandemic in 1890 that maybe was confused for an influenza pandemic that has led to the death of about 1 million people around the world. And there is more and more growing evidence that that pandemic in 1890 was actually due to another coronavirus, similar to what we are witnessing today. And the numbers of deaths so far around the world is almost 1 million, similar to what happened in 1890. So this is a natural phenomena that happens throughout the millennia and centuries. And this is against the theory that this is a man-made virus. Coronavirus family, there are more than 40, around 45 named coronaviruses that are known to cause infections, mostly in animals. All coronaviruses are zoonotic. That is, they originate in animals, and many of them end up causing infections in humans. And it's believed that all the common cold coronaviruses, all the 4, have probably originated in animals over hundreds of years or maybe thousands of years and then they became human viruses. There are animal reservoirs in the wild where the virus resides, and these are typically bats and rodents. And the virus lives in harmony and in peace with these animals. They don't cause symptoms in these animals. However, they can transmit to intermediate animal hosts before they jump to humans, and they can cause disease in those animal hosts. And you remember that in 2003, the host animal was the civet cat. In the case of MERS corona, the Middle East Respiratory Syndrome corona, the host animal was camels. For SARS-CoV-2, the COVID-19 virus, it's not clear yet what was the host animal after it jumped from bats and before it jumped to humans. But that's usually what happens. So the virus jumps from bats and rodents to another animal before it jumps to humans and then becomes a human virus. And it takes a very long time of circles or cycles of infection in the humans before the virus becomes a mild disease. So chances are that the COVID-19 virus probably will become a common cold virus in the future, but it's not clear how long that will take. It may take many years for this to happen. So we cannot wait until then, and the vaccine is very important to limit its spread and the damage that it's causing to the world. How infectious is SARS-CoV-2, the cause of COVID-19? In the absence of any interventions, on average, an infected and infectious person will transmit the infection roughly to one other person per day. The probability of SARS-CoV-2 transmission in one contact between an infected person and a susceptible person is about ranges between 1% and 5%. The degree of infectivity of a person depends on the number of people exposed, the duration of exposure, and the infectivity of the index case. This is just to illustrate to you a concept of reproduction number. Each virus has a reproduction number, and it means for every infected person, this infected person will transmit the infection to how many more people before he or she is not infectious. And it really varies from virus to virus, and also depends on the extent of the efforts of containment of the infection. For example, for influenza, the reproduction number ranges between 1.5 to 3. For other viruses, it can be higher or lower. A virus with a reproduction number of 2, like in the example in the slide, can, after 4 cycles of transmissions or 4 generations of transmission, can lead to the infection of 12 people. But a virus with a reproduction number of 3, just going from 2 to 3, after 4 cycles, there will be 81 people who get infected. So it really jumps very quickly as the reproduction number increases. In China, when the COVID-19 pandemic started, the early reproduction number of the virus was very high. It was around 4. That means every person infected 4 people before they became non-infectious. With the public health measures that were implemented and with the lockdown that was adopted on the 23rd of January, the reproduction number, the R0, dropped very quickly to below 1. If the RT can be, or the R0 can be maintained below 1 for a long time, then this can significantly decrease the rate of transmission in a community, and the virus will disappear after some time. If the reproduction number is higher than 1, that means each person infects more than 1 person, and this results in increase or at least sustainability of the virus in the community. This graph shows the kinetics of SARS-CoV-2 infection, the virus that caused COVID-19. So in the average incubation period, that means between the time between catching the virus and the appearance of symptoms, range is between 4 and 6 days. On average, it's 5.5 days. But there is a latency period of 4 days where the person who gets the infection is usually not infectious. This is where the PCR test is negative. This is followed by 2 days of what we call pre-symptomatic, where the person can transmit the virus, but they don't have symptoms. And then 2 days of symptoms, where the person can also transmit the virus. So on average, an infected person can actively transmit the virus to other people in a window of 4 days. And then after the 4th day, then they quickly become non-infectious. Their PCR shows the highest concentration of the virus in those 4 days, the 2 days before symptoms and the 2 days after symptoms. After that, the concentration of the virus declines very, very quickly. The virus causes a wide spectrum of illness. Among people who come to the healthcare system or who develop symptoms, we're not talking about asymptomatic now, about 81% of those who are infected, the disease is mild and self-limiting. In about 14%, the disease is severe. Severe means having shortness of breath and having more than 50% of the lungs involved on chest X-ray. And about 5% end up in the intensive care unit. And this differs for different countries, but the overall fatality rate is 2.3% from the studies that came from China initially in the phase of the pandemic. But again, this varies depending on the country and the population that is studied and the extent to which testing is being done. So it's not very clear yet what's the percent fatality rate of the virus. Death among patients who are infected with the virus depends on the age of the infected persons. So the age category plays a very important role in determining the rate of death. You can see on the graph on the left side that younger people have very low death rates, but then as people enter the age of 60 and above, then the death rate because of COVID increases very quickly. And the highest death rate is among people above the age of 80. This is not to say that death does not happen in young people. It does happen, especially if they have chronic conditions. And the graph on the right shows the most common chronic conditions that are associated with increased risk of death because of COVID, and this includes hypertension, diabetes, heart disease, and renal disease, among other chronic conditions. This is just to illustrate how people with pneumonia due to COVID chest X-ray look like. This is a typical COVID pneumonia where both lungs are affected. You can see the white haze on your left side, which is the right lung, and also to a lesser extent in the left lung. So this is what brings people to the hospital. This is what causes people to become short of breath and cannot maintain oxygenation. In some of those patients, oxygen is required in addition to other treatment, and sometimes this pneumonia or the infection of the lungs gets much worse to the point where the patient develops completely white lungs and they cannot breathe and they have to be placed on the ventilator. A percentage of those patients, although they recover from the virus and they survive, will end up with fibrosis of their lungs. And the extent of fibrosis could be minimal or could be significant to the point where the lungs are not functioning anymore and they cannot exchange oxygen. Unfortunately, the infection is not restricted to the lungs. The virus will find its way to other organs like the kidneys and the brain and the heart, and can cause damage to those organs as well. And people can die from complications such as central nervous system or bleeding in the brain or kidney failure. Here in Qatar, the first case, the very first case that we diagnosed was on February 28, and this was a young Qatari man who returned from the Islamic Republic of Iran on 27th of February. And you remember at that time, the virus was widespread in the Islamic Republic of Iran. The very first case we diagnosed in Qatar that did not have history of travel and was not associated with travel was in an Asian craftsman worker on March 8 who presented with severe pneumonia to one of our hospitals. And then when we started doing contact tracing for that patient, we found many more infected people. This is a graph that shows the pattern of the epidemic here in Qatar since the start. And you can see that around the middle of April, the numbers started escalating very quickly until we reached a peak around the end of May and the beginning of June. At that point, we were diagnosing about 2,000 patients every day. So that was the highest peak that we reached. And then with public health interventions and active measures and semi-lockdowns, the epidemic quickly declined and then reached its lowest level in early August and remained at low level endemicity since that time. This graph is similar to the previous graph reflecting the pattern of the epidemic in Qatar. However, it's also showing those who test positive, but they resolve the infection. This is what we call the CT value that we started adopting here in our country, where we not only look at the test if it's positive or negative, but look to see what's the concentration of the virus in the respiratory secretions. And if the concentration is low, as indicated by a CT value of more than 30, then this means that this person has actually resolved the infection. This has a public health implication because those who resolve the infection don't need to be isolated for a long time, and the contacts also don't need to be quarantined for a long time. So the color in green and red indicates the percentage of people who have resolved the infection but still test positive. And every day it's about 15 to 20% of those who test positive in Qatar are people who already have resolved the infection and have high CT values on their PCR tests. This graph shows the subpopulation of Qatar, mainly the Qataris and what we call the white-collar professionals. The behavior of the epidemic in this group of the population is different from the overall population, where you can see that we have several peaks, and the third peak started after 2nd of August, which is soon after Eid al-Adha. And we believe that Eid and the social gathering has led to this peak. And then with public health control measures, it quickly came down. So the virus or the epidemic in the country has changed from predominantly infecting crafts and manual workers to predominantly infecting Qataris and white-collar population, the professional population and their families. And this is the group of the population that hosts those who are at greater risk for COVID-19. This is a graph showing the positivity of the daily tests that we do in the country. Every day we run between 5,000 and maybe sometimes 9,000 tests. And the positivity rate, overall positivity rate, is an important indicator of the activity of the virus in the community. And we are monitoring this very closely. You can see that during the peak, the positivity rate of the clinical samples on PCR testing reached 41%. That means out of every 100 people tested, 40 tested positive. But now with the control measures and the diminution of the epidemic, we reached around 5% positivity rate. This graph shows the positivity rate among people who come to the healthcare system and who have symptoms, which is in the orange curve. At this time, it's around 12%. It varies between 8 and 12%. So all people who come to the system with symptoms. At some point early in August, it was 20%. And the blue curve reflects the positivity rate among the close contacts. And it stands at 9% at this point. But before, it was around 15%, the close contacts of those people who test positive. This curve is showing the surveys and the positivity rate in the surveys that we do every day. The Ministry of Health runs about 2,000 to 2,500 survey tests where teams go to the businesses like malls, shopping complexes, restaurants, and also the healthcare sector, and they test healthcare workers. They test otherwise healthy people. They take random samples and we test them for the virus, and we run between 1 and 2%. And this is one of the indicators that the Ministry of Health is following very closely. And 1 to 2% is reassuring. This curve shows the positivity rates among individuals who come to the healthcare system and ask to be tested for any reason. And it's at 2%, so that's also considered reasonable. Qatar is one of the countries that does a very high number of tests on daily basis per 1,000 population. We do about between 2 and 4 tests per 1,000 population per day. And this makes us one of the countries that included on the list of countries that do the highest number of daily tests for corona. And you can see here that in this graph we rank the third. At some point we rank the third in terms of number of testing. This slide shows the daily admissions to the hospital among those who develop severe disease that requires admission. This is a very important indicator. It tells you how much pressure the virus is putting on the healthcare system. You can see that at some point in the peak, we admitted around 320 patients every day, and this fortunately quickly declined. At this time, we are admitting about 40 to 50 acutely sick patients to the hospital every day. And when it comes to the intensive care unit, during the peak, we were admitting between 20 and 27 cases every day, and this number came down. Now, on average, we admit about 5 patients to the intensive care every day. This slide shows the cumulative number of deaths in Qatar due to COVID-19. And we are one of the countries with the lowest rates of death around the world. And we attribute this to a number of reasons, including early detection, very high quality of care, and excellent intensive care support for our patients. In addition to protecting the vulnerable population from being infected with the virus. At this point, until yesterday, we had 211 cases of death reported since the start of the epidemic in the country. And this slide shows Qatar having a death rate of about 74.6 per million population, and we compare favorably to other countries in the region and in the world. And this slide shows that Qatar is down there with Singapore as one of the countries with the lowest rates of death, and we are thankful for this. I would like to talk about the epidemiologic factors and the public health measures that shaped COVID-19 pandemic and the severity of the pandemic in the country. And these are 5 key points that I will describe in more details in the next few slides. First, effective governance structure to respond to the pandemic, government actions and public health measures, structure and demographic of the population, rapid response and expansion of the healthcare system with direction of resources and deployment of staff, and high pre-existing coronavirus immune cross-reactivity in Qatar. So first, the governance structure. The country put together a tailor-made governance structure to respond to the pandemic, the corona pandemic. This structure proved to be very effective and efficient and led to the very rapid communication of information both ways, either upwards or downwards, and also helped to make decisions very rapidly and to implement them very quickly. So on top of the pyramid, or on top of the structure, sits the Minister of Health, who chairs the National Multi-Sectorial COVID-19 Committee. And this committee proved to be very helpful in containing the epidemic. There is a senior representative from each of the ministries in the country, and this committee is chaired by the Minister of Health. The role for this committee is to make important high-level decisions and to implement them immediately or raise them to the government for quick approval. Things like closing the schools, closing the mosques, closing the mall, reducing the number of flights, or stopping people from coming to the country. So very big decisions were taken at this level. And those decisions were informed by recommendations that came from the Health Strategic Command Group, which sits in the middle, and this committee reports to the Minister of Health. This committee raises strategic recommendations to the Minister on things like closing schools, closing mosques, directing resources, opening more beds, or implementing statewide quarantines and similar measures. And this National Strategic Group or Command Group oversees 2 other committees. One of them is the Tactical Command Group on Healthcare, which is responsible for rapid expansion of the healthcare delivery system to accommodate more acute admissions and ICU admissions, and to provide the necessary medical and nursing support, as well as treatment and communicating this information to the strategic health group. The other command group is the Tactical Command Group on Community Services, and this is responsible for things like quarantine and other public health measures, contact tracing, and responsible for policies related to testing and surveys. And also this committee reports to the National Strategic Group. These committees are supported by 4 functions: the performance and planning team that provides background support and helps put guidelines together; the scientific research group, which reviews the clinical evidence and the latest literature on any decision, any important decision to be made, and this feeds its recommendations to the National Strategic Group. The other two groups that support the strategic group is the communication team that's responsible for fighting misinformation and spreading the right information, and the logistics team that's responsible for resources. I would like to acknowledge the role each of the members of those committees played in combating the epidemic in the country, as well as the frontline workers. Thank you. The impact of the public health response to on SARS infection in Qatar, the public health response played very important role in combating the epidemic. The epidemic would have been peaked much more than it did in the end of May if the public health measures were not implemented. This graph shows that in red, that would be the numbers of actual cases if we did not take public health measures. And the curve in blue shows the real numbers. And you can see that there was about 79% reduction in the number of cases if the public health measures were not in place. And public health measures means early detection, isolation, quarantine, and which make the cornerstone of any public health response. Similarly, the scale of the epidemic would have been much bigger. The total number of people who are infected would be much higher if the public health measures were not implemented. The curve in red, which shows that an additional 1 million people would be infected if the right public health measures were not implemented. And the same thing for acute admissions to the hospital. We estimate that there was about 75% reduction of acute admissions to the hospital because of the active public health measures and because of the measures taken by the government in terms of closing businesses and closing schools and things like that. The same thing for intensive care unit admissions. We would have been hit hard with many ICU admissions was it not for those public health measures and the measures that were taken by the government to decrease the spread of the virus in the country. So why SARS epidemic in Qatar has been relatively large? Why did we report more cases than other countries? First, we need to understand that respiratory viruses depend on social networks, and the virus has evolved to take advantage of the social behavior of humans, because humans like to get together, and the virus use that to its best ability to jump from one person to person. And the more dense the social network, the closer people together, the more likely the virus will jump between people. This is a case study from the UK from a boarding school where the reproduction number for influenza in one of the years was 15. That means each person infected 15 people, and this was very high. And this was used as an example for describing other pandemics, what's called the boarding school effect. Here in Qatar, like many countries in the region, we have a large number of crafts and manual workers who reside in work together and reside together in camps, and they share rooms and they share dining areas. And this has the ability to spread the virus like the boarding schools, where viruses can easily spread among such people in such living conditions. And that led to the spread of the virus in big wave among the crafts manual workers. The healthcare response in Qatar did a great job in combating the severity of the illness in the country. The healthcare sector in Qatar was well prepared even before the pandemic. We had significant infrastructure and resources that helped us fight the pandemic. We also quickly responded by expanding the number of beds, both the acute beds and the intensive care beds, and we redeployed our staff across the system, and the whole system worked as one body. The tertiary healthcare system, the primary care, and the Ministry of Health worked together as one body in fighting the epidemic. And the academic partners in the country played very important part in fighting the infection, and I must acknowledge their role. This includes entities like Qatar University and Weill Cornell Qatar. The mortality rates, because of the effective response of the healthcare sector, is about 10-fold lower than other countries, like I described earlier. And the mortality rates in our ICUs were less than 10%. If you compare this to other countries where the mortality rate is maybe 25%. So we have significantly lower mortality rates in Qatar. This is another reason that theoretically could have helped in slowing or reducing the severity of corona in the country. This is still theory, it's not really proven yet, but it's believed that previous exposures to other common cold coronaviruses may have created some cross-reactivity to the SARS-CoV virus that causes COVID-19, and that may have resulted in more mild form of COVID-19 in young people, particularly the crafts and manual workers. But this has to be proven. At this point, Qatar is, the epidemic in Qatar is of low level to medium level endemicity. The virus is still there. It's not coming back in waves like we are seeing in other countries, like the European countries, fortunately. The figures are up and down from day to day and weekend to week. Most of the spread of the virus is through social gathering and social visits and social occasions like parties or meeting in majlises. And it's less so from schools or businesses, which is somewhat reassuring. However, this is worrying at the same time because it's affecting, at this point, the Qataris and the white-collar professionals, and these subpopulation, as I described earlier, host the most vulnerable group of the population for COVID-19, which are the elderly and those with chronic conditions. The Ministry of Health at this point is monitoring, I meant to speak about the lifting of the restrictions. We are now in Qatar in phase 4 of lifting of the restrictions, which is the final phase of lifting of the restrictions, which started in the beginning of September with also the reopening of the schools and opening of other activities and businesses. Since the start of September, we are not seeing significant increase in the rates of coronavirus, fortunately. So that's somewhat reassuring. However, the country is ready to re-escalate restrictions if needed, if the indicators are showing that the virus is coming back. And the Ministry of Health has set or put together 9 indicators that it's following. And these indicators are listed here for you. They are related to epidemiology, healthcare capacity, and public health. And those indicators will guide the Ministry of Health to make recommendations to the government if restrictions or the current level of lifting of restrictions should continue, or if there should be reimposing of some of the restrictions to contain the virus. So the only way out, I think, of this pandemic for Qatar and for the rest of the world is to have an effective vaccine, a safe and effective vaccine. There are many promising candidates that are in the pipeline, and we hope to start to see the results of the phase 3 clinical trials by end of October for some of them, and hopefully that will lead to the approval of some of them to be used for the prevention of the spread of the virus. Although vaccines may be approved before the end of the year, it may take time for all the countries or most of the countries to acquire the vaccines in large enough quantities to protect the population. Most likely the virus for the next few years will behave like influenza is behaving, where it's coming back every year in waves that can be controlled or reduced by the use of vaccine, which could be annual every year or every other year or every few years. We are not sure yet. But hopefully we will be able to control the virus and start going back to normal level of activities, whether it's businesses, economy, travel, social activities, education, etc. So I'll stop at this point and thank you very much for your attention.
Actually, this lecture gave us an idea about this non-welcomed visitor. But our efforts and measures should continue in order to finalize and completely stop this pandemic. There are some questions. Let's take some questions from the world. There are conflicts of, the declarations coming from WHO. Therefore, there is lack of confidence, and some countries are not taking these declarations in full confidence. Yes, unfortunately, in the beginning, there were a lot of things which are not clear about this pandemic, and a lot of the things that I've described here in this lecture were not known then, at that time. This led to conflict of information, and I don't blame WHO because they are under pressure from all worldwide, all countries, and mistakes happen, especially that there are no much information and accurate information about this virus. But this would not hinder the standpoint of the WHO and their leading role in the health of the world. They are playing a great role in saving millions of spirits through different programs related to viruses or chronic diseases. So we should not judge the WHO for one or two mistakes that are not of that value in relation to one virus, which is COVID virus. And, taking out the confidence from the WHO will not be of beneficial, and it will be not beneficial for the WHO and also for the world. So we should be very wise in dealing with the WHO. One of the reasons why this disease is spreading, you mentioned networking, social networking. Some people who are not committed or comply with the quarantine and the instructions that they should stay home or stay on quarantine. Don't you think that the Qatari community in general can go out of this without having big losses, and also in mortality factor, or in the beginning of the pandemic, there were a lot of compliance and commitment from Qatari and from residents in all the measures, which is not going to visit, not going out all the time, wearing the masks, washing hands. They were very committed. But after some time, people feel bored, and they feel that they are careless. Some of them were careless, and therefore we witnessed the spread of the virus, especially among young people who are around 20 years old. Even though it is not very, dangerous cases, because they are of this age group. But at the end, they will go back home, and they might transmit or communicate the the virus or the sickness or the illness to their parents, to their grandparents, and this will lead to very serious cases in the community. So stopping the spread of the virus will be through simple measures, wearing the masks and having a safe distance between others, 2 meters or 1.5 meters, and not to go in crowded areas. And these are very simple measures, and the results were very big and very high, saving lives, saving people from going to the hospital. This is unfortunately the feeling of people, and being careless for small portion of the community, especially the young people. I really want to take this opportunity to say to these people, please go back to be committed, comply. You have to be responsible. You will affect your families, your people, your community. You spoke about collaboration. The question for the collaboration between countries, what are the biggest countries or the most countries who collaborated with Qatar, especially that Qatar supported a lot of countries, especially in Asia and other regions also, and they provided them with many medical aids. So can you clarify that, please? In the beginning of the pandemic, a lot of countries found themselves that they need to collaborate with other countries because they cannot alone deal with the virus, especially if we know that a lot of the things that we need and many countries need are not made in the or manufactured in their country but in other countries. So in the beginning of the pandemic and the spread or outbreak of that pandemic, a lot of countries wanted to take from the experience of China in dealing with the pandemic. A lot of countries went to China to look at the preventive clothes, the masks, and China was the factory of the whole world in this field. All countries, among which Qatar looked at the collaborating with China, and still we are collaborating with them, and we could gain from them information and acquire also the prevention requirements. We also cooperated with Cuba, where Qatar really attracted a good number of doctors and nurses, because we have lack not only in the state of Qatar but in the whole world. We have a shortage in our cadre, medical cadre. A lot of people come to the hospitals and admitted for corona, emergencies and internal units, ICUs. They need more and more doctors. So we collaborated with Cuba in great deal. And there is also collaboration with other countries, with Italy, research related to COVID. And also there is collaboration with other countries. The second part of the question, there were instructions from His Highness the Emir about providing aids for some countries who faced corona pandemic. Can you give us names of such countries that got aids from the state of Qatar? As we needed a lot of aids and help in other things, in many things, and support in many things. Also, other countries need support and help. So the state of Qatar have a leading role and a great role that they played in this critical period. And the state of Qatar had initiated a lot of helps to countries, among which are China. China, really a great country, but also Qatar helped China in combating corona. Italy also. they are developed countries, but there were a big pressure on the medical sector. So the state of Qatar helped, and also Islamic Republic of Iran, which is a neighboring country. So this what we had in mind, and this was a very good thing, an initiative that we are proud of. The question that we have in two parts: what are the reasons why we have no vaccines until now for this disease? And what do you think about this vaccine? Actually, there is no lateness in the production of this vaccine, but actually it's opposite. If we have the vaccine in October or November, so this is a really world record in producing vaccines. But if you look at the history of producing vaccines that are approved and used now, the vaccine needs in range 10 years since starting from the production, starting from the manufacturing until the production. So the virus came 10 months ago, so maybe after 10 months we'll get a vaccine which is approved, and this is, I think, a well-known and a big record. And there are a lot of sectors that will produce these vaccines, and this will open the horizon to humanities to look at a certain track in producing vaccines. So if there are a new virus that could come in the future, people will be faster maybe in producing the vaccines. And we wish to have the first vaccine in October or November, and maybe from different companies, American and European, and we wish that it will be available in the state of Qatar and in the GCC countries before the end of the year. This is the best case scenario. But if it's not by the end of the year, maybe it will be in the early months of next year. And on behalf of every one of you, we would like to thank Dr. Abdullatif Khal.